Good evening, everyone. We're going to give it a few seconds before we begin to let everyone into the webinar. Thank you for joining us this evening. Okay. Good evening, everyone, and thank you for joining us tonight for one of Rohrer Aesthetics webinar's treatment talks focusing on skin resurfacing. My name is Chad Sulak. I will be one of your speakers this evening. I'm the Associate Director of Marketing here at Rohrer Aesthetics. I've been in the aesthetics industry for over 12 years, working with names such as Hydrofacial, Crown Aesthetics, now Revance, and Truma BCT. And I was lucky enough to join Rohrer back in 2024. With me tonight is Madison Summer, our medical affairs specialist. She has over 15 years of experience in the aesthetics and plastic surgery space and has been with Rohrer since 2020. So for those of you joining us who may not be overly familiar with Rohrer Aesthetics, we have been delivering big device energy for over 10 years. And we've been empowering our practices with accessible, effective, and practice-building energy-based devices to non-invasively treat the range of patients' wants and needs. We are the number one choice for energy-based devices because we are trusted, established, and accessible. What that means is we're the go-to for FDA-cleared devices, multimodality devices. We have the gold standard on wavelengths. We've treated millions of patients. We have over 10 years of providing a wide array of in-demand devices, including leading-edge non-invasive technologies. And most importantly, we're accessible. We have transparent pricing on all of our advertisements and websites, so you can see exactly how much our devices cost and how quickly you can obtain your ROI. As well as we have resolution-ready customer service, meaning we're always here to help, with best-in-class education and training to make sure that you are always performing at your top tier and ensuring your patients get the best results possible. We are unrivaled by the numbers. So we have over 5,000 devices sold nationwide. We address 90% of patients' wants and needs throughout our portfolio. We have a 99.9% always on operational readiness, meaning when you go to turn on your device, it will be able to be turned on and ready to function. 60% of our customers own 3 or more of our aesthetic devices, with over 10 years of supporting practice growth. I want to inform you of an upcoming event that we're hosting in Dallas, Texas called the Energy Expo. The Energy Expo is where we get some keynote speakers. In this case, it's going to be Dr. Julie Rusak. We go over best practices, how to use the devices, demos. So you can see hands-on training. It's a wonderful day of learning more about the devices, Rohrer Aesthetics, how to position your practice, what's best for your patients, and really an all-around great training and learning opportunity. It is going to be on November 15th in Dallas, Texas. If you're interested in joining, please scan the QR code to register or speak with your local Rohrer Aesthetics representative. I also want to inform you of a new program that we've just launched called the Advantage Partnership Program. Now, this is only available for a limited time. There are very limited slots available, but basically, Rohrer Aesthetics will cover up to 12 months of your device payments, meaning if you buy a device from Rohrer Aesthetics, we will cover up to 12 months of the payments of that device. We are doing this to show that we are invested in your practice. We want to show that Rohrer Aesthetics is not here to just sell you a product and then disappear. We want to invest in you. We want to see you grow, and we want to make sure that we are standing behind our products more than just saying it by actually demonstrating it. So to see if you qualify, you can visit rohrersthetics.com. You can speak with your local Rohrer Aesthetics representative and see how you can get up to 12 months of your device payments covered. For this evening, we're going to be going over a few different topics, starting with what is skin resurfacing, Phoenix CO2 overview, which is our CO2 device, a Pico laser overview, Erbium, a comprehensive comparison, and then a discussion about the art of combination therapy. At the end, we will be doing a Q&A. As a reminder, you can submit your questions for the Q&A portion at the bottom of your screen. You will see a tab or a button that says Q&A. Please feel free to submit your answers there. If for any reason at the end of this we are not able to get to your question, we will do our best to address it, or you can reach out to Rohrer Aesthetics directly through our website, rohraesthetics.com, and we'll do our best to address your questions. So why did we choose skin resurfacing for this webinar? Well, in 2024, over 3.7 million Americans had skin resurfacing procedures, with 3.2 million Americans being between the age ranges of 30 and 69. It was the third most performed minimally invasive procedure done. In 2025, it has jumped to the #1 most requested cosmetic procedure, and that's treatments to tighten skin or smooth wrinkles. And this is data from the American Society of Plastic Surgeons, as well as the ASDS Consumer Survey from 2025. So when we were putting together a webinar, we wanted to focus on what patients were asking for so that you were well educated and can address these concerns head on. With that, I would like to turn it over to Madison Summer to take over our treatment talks on skin resurfacing.
Hello, good evening, everyone. As Chad introduced me, this is Madison Summer, Medical Affairs Specialist with Rohrer Aesthetics, and tonight we are going to explore laser skin resurfacing together. What is laser skin resurfacing? Laser skin resurfacing works by utilizing focused energy to vaporize the outer layers of skin, a process that removes damaged cells and stimulates the production of new collagen fibers in the underlying layers. General treatment goals include improving texture, tone, and pigmentation concerns. There are multiple types of resurfacing technologies available in the marketplace, and each play a unique role in skin rejuvenation. Rohrer Aesthetics has 3 resurfacing technologies: the Phoenix CO2 laser, the Pico laser, and Erbium laser, which is found on both the Spectrum and the Pixie devices. We're going to take a closer look at each of these technologies and their unique roles in the aesthetic field. First, let's review the Phoenix laser, a uniquely adaptable CO2 laser with applications to treat the face, neck, chest, and hands. The Phoenix is a fractionated carbon dioxide laser. Fractionated CO2 lasers produce an array of microthermal treatment zones with a pattern of ablation that is capable of reaching deeper dermal tissue. As energy is absorbed in the tissue, a triad of events occur that results in dramatic outcomes. First, heat from the laser causes that collagen fiber to contract, which provides an immediate tightening effect on the skin. This is often most noticeable around the jawline, the eyes, and the cheeks. Second, columns of tissue are vaporized when the laser's light energy is absorbed by water in the skin, causing tissue to turn to vapor. The body responds to this vaporization by initiating the natural healing process. 48 hours after the treatment, as the skin starts to heal, a proliferation of new epidermal cells replaces the previously reduced cells. And third, this healing process induces dermal remodeling, new collagen, new elastin, which leads to tighter, smoother skin. It is important to note that this process is not as immediate as the contraction and vaporization is. While it is initiated as tissue is selectively thermalized, remodeling will begin to occur 2 weeks following the treatment and continue for up to 3 to 6 months. The combination of immediate contraction, new epidermal cells, and new collagen production makes CO2 lasers an effective treatment option for improving skin laxity, wrinkles, pigmentation, and acne scars. While ablative resurfacing produces the most dramatic outcomes, there is downtime to consider. With the Phoenix CO2 laser, the provider has the capability to configure treatment settings to control depth of energy and the density of the energy, in turn allowing control of treatment results and downtime. Along with managing treatment energy, the depth, and the density, which is your coverage, the provider can also adjust the size and shape of the treatment zone. In this video, the provider is using the square shape with a 21mm treatment zone to address the forehead. Careful consideration is taken to avoid any gaps or heavy overlap between pulses to allow for consistent, even coverage. These are some of the dramatic before and after results that can be seen with the Phoenix CO2. Improvement in texture and pigment can be seen for the patient on the upper left-hand corner. Tissue tightening and reduction in pigment is seen on the next 2 patients. An improvement in pigment, tone, and volume is seen here on the hands. Skin quality improvements can be seen in this before and after. This patient had one conservative treatment with settings that were utilized for this patient's treatment to attempt to minimize the downtime. Here's another great result with the CO2 laser. It illustrates the unique capability of this technology to reduce fine lines, pigment, and deeper wrinkles. This is a different view of the patient, just showing those improvements from the front. Okay, now for our second device, let's dive into the Pico laser. Pico laser delivers non-thermal picosecond technology for skin revitalization, tattoo and permanent makeup reduction on the face, neck, chest, and body. Pico laser subsurface tissue ablation utilizes Pico laser technology to generate ultra-short pulses stimulating non-thermal photoacoustic shockwaves within the skin to shatter pigment, reorganize collagen fibers, and stimulate collagen synthesis. While CO2 utilizes thermal energy to induce clinical change from the surface down, picosecond technology utilizes a unique mechanism called laser-induced optical breakdown beneath the surface of the skin. Laser-induced optical breakdown, or LIOB, forms microscopic lesions in the tissue by rapid expansion of plasma in the target area. This leads to localized ablation. These lesions can be formed in both the epidermis and the dermis depending on the selected wavelength and the energy setting. The tissue surrounding these microscopic lesions is left intact. Due to this precise control of ablation within the tissue, there is minimal to no downtime to a laser treatment. Pico laser treatments are well tolerated by patients. Topical numbing is not necessary, but we do encourage it for added comfort. A standard skin rejuvenation treatment usually takes less than 20 minutes. Current customers can find more detailed information on the Pico Laser Masterclass that is located on the clinical platform. Following a single treatment, patients report an improvement in fine lines, pigmentation, active acne, scars, vascular conditions such as rosacea, and overall tone and texture improvements with up to 30% reduction in pore size. This is a powerhouse device. In this image, you can see the significant reduction in those benign pigmented lesions on this patient's face with one treatment. This patient's before and after, what really stands out to me is the reduction in pore size and overall tone and texture. And this patient shows us almost a dramatic 100% improvement in her epidermal melasma. The last technology that we're going to review is the Erbium YAG. Erbium YAG ablative resurfacing utilizes the 2940 nanometer wavelength and either a flat optics lens or a fractionated lens to promote skin rejuvenation. Light energy is absorbed by water in the epidermis, which results in two effects. The first is vaporization of the epidermis. The second is thermal diffusion into the papillary dermis, which stimulates collagen production. Due to these two effects, the epidermal layer of the skin is precisely resurfaced, reducing visible concerns such as diffuse pigment, benign pigmented lesions, fine lines, and superficial textural irregularities. In this video, the provider is utilizing a flat optic lens for a fully ablative treatment to remove benign pigmented lesions, reduce texture irregularities, and reduce fine lines. Current customers can find more detailed information on the Erbium YAG Masterclass located on the clinical platform. So a comprehensive comparison of these three devices. While both the Erbium and the fractionated CO2 lasers are both ablative, the stark difference is that CO2 can penetrate and contract down into the dermis, while the Erbium directly affects the epidermis. Treating down into the dermis results in more significant tissue tightening and is an optimal tool for those deeper wrinkles. It is important to remember that both of these lasers are customizable, making them consumer-friendly as the provider can tailor to customers' needs. For instance, the Phoenix is a fractionally ablative CO2 with the capability of treating with a density as low as 5% or as high as 95%, which is essentially almost fully ablative. By increasing or decreasing the energy, providers control how deep into the tissue they treat. By opting for a lower density and lower energy on the Phoenix, a light laser peel treatment can be delivered with minimal downtime. That's as little as 1 to 2 days. Similarly, the Erbium laser treatment can be customized. With the option for fully ablative or fractionally ablative lens, providers can tailor to the customer's skin type, concerns, and downtime needs. Pico laser is unique in that the thermal energy is not utilized. Therefore, dramatic results can be seen in relation to pigment, inflammation, scar tissue, and vascular concerns, as well as fine lines. But without the thermal energy, we cannot expect to see those more dramatic changes in those deeper lines and wrinkles. When these technologies are utilized together, either in a sequence or a stacked treatment, more results can be expected. So I'm going to go through a few of my favorite combination treatments that as a provider, I would not want to be without. We call this the art of combination therapy. The first is in relation to acne scars. Historically, providers had to rely on ablative lasers to address scar tissue, but there were limitations in those results. With the addition of newer technology, the results are unmatched. My recommended pathway for treating acne scars is first step to utilize the Pico laser for the subcision effect. With subsurface tissue ablation, the tiny lesions or bubbles, if you will, of energy are placed under the skin within the dermis, which are proven through clinical studies to lift the scar, reorganize collagen fibers, and promote new healthy collagen. The second step I would take is next I would incorporate microneedling radiofrequency, if that's available, to mechanically break up scar fibers and to stimulate new organized dermal tissue. Pico laser and microneedling radiofrequency treatments can be completed in a stacked treatment on the same day. Third, once dermal remodeling has taken place, I would incorporate ablative resurfacing with either the Phoenix CO2 or the fully ablative Erbium to reduce scar depth and texture, essentially polishing away those superficial irregularities. Additionally, even more collagen synthesis is expected. And finally, my fourth step, once the skin quality goals are achieved, I would ice the cake with the Pico laser to reduce any post-inflammatory erythema or pigmentation that may be lingering. Another combined technique that can enhance the treatment outcome is low energy Erbium pass over a deeper CO2 treatment. By combining the deep resurfacing ability of CO2 with the superficial precision of Erbium, providers can expect a more comprehensive rejuvenation treatment outcome. This approach also minimizes side effects and leads to a faster recovery by reducing crusting, reducing swelling, itching, and the potential for the checkerboard pattern that can be seen with CO2. Studies show that patients who undergo a combined treatment are more satisfied and more likely to repeat the procedure. Another important dual action approach is incorporating microneedling radiofrequency treatments prior to Pico laser treatments when treating difficult dermal pigments such as melasma. In this approach, a series of microneedling radiofrequency treatments with the addition of transdermal application of a tyrosinase inhibitor such as tranexamic acid is completed prior to a series of Pico laser treatments. Combining these two technologies in a series addresses both the underlying structural issues seen with dermal pigment and the visible symptoms, which leads to healthier, brighter tissue with a decreased chance for pigment reoccurrence. And the last combination approach I want to discuss is the Rohrer Aesthetics Pixie treatment. The first step in Pixie treatment is microneedling radiofrequency. Radiofrequency energy heats the dermal layer, thereby causing coagulation of tissue and inducing the wound healing process. The natural wound healing process results in dermal remodeling and production of new collagen and elastin. These improvements will be seen over time, generally 3 to 6 months post-treatment. The second step in the Pixie treatment is erbium ablation to deliver a more dramatic effect to the epidermis, including a reduction in textural concerns and pigmentation. When these two technologies are combined, we enhance the results that are expected from each individual treatment. Remodeling of the epidermis, superficial dermis, and deep dermis, leading to firmer foundational support, functional repair of the basement membrane, and enhanced resurfacing of the tissue. All right, thank you guys for joining me today for our Treatment Talks Skin Resurfacing. I'm going to pass this back over to Chad.
Thank you so much, Maddie. As we sort of let all of these questions that are filing in or getting sorted right now, I want to talk to you about two quick reminders. The first one being our Energy Expo that's taking place in Dallas, Texas. If you liked some of the conversations that were had here tonight, we'll be going much more in depth at that Energy Expo, where you'll get to hear about practice growth opportunities, business development, our devices, the Rohrer aesthetic devices, see live demos, so on and so forth, with our key speakers, Dr. Julie Rusak, Ashley Herman, and of course our own Madison Summer will be there as well. You can scan that QR code to register. And a reminder that the Advantage Partnership Program is available, or you see if you're eligible for, and this includes the devices that Madison was talking about during the presentation tonight, our Phoenix and Pico. Again, that means our Advantage Partnership Program, or APP, you may be eligible to receive up to 12 payments covered for your device. So please feel free to go to rohraesthetics.com to fill out your contact information or speak to your local Rohrer Aesthetics representative for more information. So with that, I would like to turn it over to Peter McCook, the head of our clinical operations, to guide us on answering some of the questions that came in for our Q&A session. Peter?
Thank you, Chad, and thank you, Maddie. Terrific presentation once again, so really appreciate you. Thank you, everybody, for joining us this evening. We're excited to speak to you about these subjects, your subjects that are near and dear to us, and we enjoy the opportunity to interact with you on these different technologies. Maddie, one of the first questions that arose today was something that we talk about quite often. It's a quickly growing, expanding treatment option in the marketplace of interest, and specifically to permanent makeup removal with the Pico laser. The specific question is related to settings and our recommendation for treating Fitzpatrick 5 and 6s, especially on the eyebrows, but also discussing eyelid and lips. Wanted to get your thoughts on that, but also expand it to the rest of the skin types as well.
Okay, so let's start with the first part of that question. The first part of the question is treatment settings for permanent makeup reduction with the Pico laser, correct?
Yes, and specifically targeting 5s and 6s for this question, but I think we should expand it.
Okay, so to start with, when we're utilizing Pico laser for pigment reduction, we're essentially utilizing the same parameters and the same protocol that we're using for removing and reducing tattoo ink. So we are always starting with the 1064 wavelength. We are with a 1064 wavelength. Our recommended spot size is 6mm spot size, and we're recommending the lowest energy and to treat for clinical tissue response. So in most cases, you're starting with that 6mm 1064 with the lowest energy. With that, in treating darker skin types, we have a unique consideration. So when we are doing permanent makeup reduction, we can have a response that takes place called paradoxal darkening. And when that takes place, what happens is we have a pigment that was once black or brown, and it can turn to a color such as orange or red. When that takes place on a lighter skin type, the next step in the process is to come in and to reduce that with the 532. When we are treating those darker skin types, we do not have the capability to do that. And therefore, we do recommend, first of all, having that upfront conversation with your customer that if those colors, if you do utilize a 1064, if it does change colors, you could be a little bit in a pickle at that point. So we recommend coming in with a test pulse first if they want to proceed, understanding that the area where you're test pulsing can change colors. That test pulse should be delivered, and then you should reevaluate within typically 2 to 4 weeks to see how that pigment responded to the 1064 wavelength. Keeping in mind that a lot of the newer pigments, we do not see that paradoxical darkening taking place. A lot of those older pigments, something that was in the marketplace 10 years plus ago, are the ones that were making that change from that darker brown to say like the orange. So keep that in mind, but we do recommend a test pulse, or with those darker skin types, you may consider just utilizing a different method of reduction removal via saline reduction, that type of thing.
Great. Staying on with the Pico laser, this individual is asking about optimal settings of hyperpigmentation versus acne scarring, and I do like the question because it's talking about energy levels for different applications, and we have a strategy about how to approach our patients when we're first beginning to treat them.
Yeah, so the question is, how would you differ in your energy application for hyperpigmentation versus acne scarring, correct?
Yes, correct.
Okay. So in any of these cases, we are going to, when we're looking at treating both of those concerns, we're looking at, first step is what is the wavelength that we're going to select. So when I'm looking at treating concerns such as scar tissue, I'm going to want to utilize a wavelength that penetrates into the dermis. And that wavelength is the 1064 nanometer wavelength. So first, I'm going to start with a fractional lens for the 1064 wavelength to create that photoacoustic energy effect, creating that Liobe effect, which will in turn create that clinical change in the dermis to break up those fibrous bands that are causing a lot of that conditional in the tissue. And then I'm always going to start at my lower energy and assess for clinical tissue response. What we know about Pico laser is it's not always those higher energies that are making significant clinical changes. So we're recommending you start on your lower energies and you increase based off of that kind of that erythema that you may see, that clinical change. When we are treating scar tissue, we know that we typically are utilizing a heavier overlap than if we are treating, say, something such as pigment. And again, I'm wanting to create more of that Liobe response in the tissue, and I'm wanting to make more significant clinical change in an area that may be more dense and more fibrous. So a little bit more overlap, still utilizing those lower energies, still utilizing that 1064 wavelength. When we are treating pigment that is located within the dermis, be it hyperpigmentation, which we know a lot of the times we're treating something like post-inflammatory hyperpigmentation or melasma. In those instances, we're going to start with the 1064 wavelength, number one, because it's treating pigment within the dermis. And number two, because we want to repair the dermis. A lot of those pigments concerns are taking place because we have a disrepair of the dermal tissue. That basement membrane is in disrepair. The overall function of the dermis needs that new collagen, new elastin, that remodeling to take place. And so I'm always going to start there with that 1064 fractional lens to make those dermal clinical changes. If the patient has epidermal pigment as well, that can be melasma, it may just be sun damage. In the instance that we have epidermal pigment, we do want to utilize the 532 wavelength. The 532 wavelength has a higher attraction to pigment. So therefore, you will see a more immediate reduction in that pigment. It may be as little as one treatment. And in that case, it is you're going to see that more significant than you would say in those deeper dermal pigments when we're utilizing that 1064 wavelength. Fractional lens can be utilized for those cases. We also can come in at the end of the treatment if we're treating epidermal pigment, say we have a benign pigmented lesion, a patch of epidermal melasma, maybe say similar to the area on that patient's forehead. In those instances, we have a patch of pigment that's similar to, say, it's something I can draw out and mark a line around. It is an area of pigment that has defined borders. When I see that, I know that I'll likely want to utilize my telescopic lens to come in and treat those areas. Now, if it is epidermal, I'm going to utilize my 532 wavelength. If it is dermal, you may consider utilizing your 1064 wavelength. And again, that's telescopic lens, and we're utilizing lowest energy. We're utilizing the spot size that's appropriate for our wavelength. If that's 1064, that's a 6mm spot size, is our starting spot size. If it is 532, it's a starting spot size of 4mm, lowest energy, and coming in over those defined borders of pigment. Just got talked a lot just then, but is there anything else that you can think of that I did miss down there?
No, I think that was very thorough and well stated. So thank you for that. And there's also the opportunity to review our masterclass series, and we'll be adding another masterclass on permanent makeup. I should let everybody know shortly to continue to expand on that. There is a question about managing the skin post-ablation, CO2 or erbium when the skin is compromised. Can you speak to our recommendations of how we would guide our customers in that maintenance and care?
Yeah, absolutely. So first off, I want to say that if you have not seen the Pearls and Pitfalls Masterclass located on the clinical platform, if that's news to you, that is there. And that is a deep dive into what kind of pitfalls we may come against when we're doing laser treatments, what kind of things do we need to be aware of, how to best set our patients up for success pre-treatment, and how to best set our patients up for success post-treatment. It also dives into some of the pitfalls that we may come up against and how to best manage those pitfalls if they do occur. And because of the unique considerations with ablative treatments, we may need to take even more considerations with those ablative treatments. There's a deep dive into that on that Pearls and Pitfalls Masterclass. From there, one of the most important things I can say pre-treatment is make sure to set your patient's skin up for success. So making sure that we are having those patients on a what we call like the 3 most important products we can use. Number 1, making sure they're utilizing a good quality sun block for that UVA, UVB block, so we do not set our patients up for compromised tissue pre-treatment. We want to make sure that our patients, if they have the availability to utilize a quality vitamin C and a quality vitamin A. So keeping those considerations in mind, set your patients up for success for the ultimate best outcomes with a laser treatment. Post-treatment, a lot of that comes to just protecting the skin. And as a company, you've probably heard it from us that we have our ablative recovery kit, and that is a specialized kit that we put together with unique considerations that we see post-ablative that can cause compromise in the tissue. So the number 1 consideration is, what is the ointment that you're putting on the tissue? We want to make sure that our customers are not utilizing ointment that has lanolin in it. Lanolin has a high potential for a topical reaction, which in turn can lead to swelling and erythema and itchy skin that we do not want our patients to come up against. So we want you to utilize an ointment that does not have lanolin. Vaseline is an option, but what we did is we partnered with a pharmaceutical company to put together an that is semi-permeable, which means that is not as thick and greasy as the Vaseline. It does still allow the skin to breathe because it is semi-permeable, and it has green tea and ointment in it, which means that it's protecting with that extra layer as well as kind of calming the skin after the treatment. So a good ointment, that be it the green tea ointment with our ablative recovery kit, or an ointment such as Vaseline that does not include lanolin. We want to make sure our patients are utilizing gentle face washes. I cannot go into that enough. If it is a face wash that burns the eyes or feels irritating even without a laser treatment, it's going to do even worse when the tissue is ablated. So a nice gentle cleanser. With our ablative recovery kit, we do have our papaya enzyme cleanser. Not only is it gentle enough to put on freshly ablated skin, but it also softens the skin and accelerates the removal of dead skin cells. So that's an added benefit there. Once the tissue has reepithelialized, which means that we have all those new cells that are in place at that point, and usually that's taking place, like I said, 48 hours, we start to see those new skin cells starting to take place. But after 3 days, 3 to 5 days, depending on how aggressive you got, what your treatment actually was it CO2 or erbium? In those cases, we are going to utilize we're stopping the green tea ointment or the Vaseline, and we are transitioning to a thicker, heavy moisturizer. What we do not want is for this compromised skin to dry out. If the skin dries out, that's when the patient starts to get even more itchy. The skin looks worse than it did before. We want to make sure our patients are hydrating orally, but also that we're utilizing some quality products to keep their skin hydrated. And that is with the ablative recovery kit. That includes our phytocorrective serum, which is a hyaluronic acid green tea serum that does soothe and calm the skin. It does reduce redness, but again, it's at HA, so it's hydrating the tissue, as well as incorporating our lipid replenishing cream. So that's that nice, creamy, nourishing lotion that helps to support skin self-repair. And finally, lastly, we want to make sure that our patients, once reepithelialization takes place, most important thing that they do is they protect their skin from the sun. So with that kit, it also includes mineral sunblock. If you're not utilizing the ablative recovery kit, I would recommend that you utilize a mineral sunblock that protects against both, again, those UVA, UVB rays. And
Excellent.
the last, one more thing I want to add to
Okay, good.
If you're not aware of the product, it's hypochlorous acid. There's not lots of name brands. I believe you can get it called a magic molecule. You can call it Puricin. You can call it Resurfacing. There's lots of different brands for the hypochlorous acid, but that's something else I would encourage you to have your patients use. Not only can they keep it in the fridge and spritz it on their skin between washes or when their skin just feels kind of dry and hot, it also helps to prevent against infection and decreases inflammation and redness. So that is a product that I would say everybody, if you don't already utilize it, look into it.
Excellent. Perfect wrap up to that particular portion. But there's one more question I think that we want to touch on. Maddie, and you and I have talked about this quite a lot. There's emerging various studies that speak to utilizing the Pico energy for vascular concerns. And it's intriguing and exciting, and we're beginning to understand some of the mechanisms of action. So can you speak to that in general and maybe some specifics with regards to mechanisms, any vascular concerns, acne included?
Yeah, absolutely. So what we know with a lot of these concerns, and with a Pico laser in general, we know that it is newer technology. So what was 5 years ago only utilized for tattoo reduction is now, like I said, it's becoming the powerhouse device that is utilized for virtually almost everything. I feel like we're finding out. So what we know is that Pico laser how can it help with something like a vascular concern? It decreases inflammation. It specifically can target those mast cells. Those mast cells are a large contributing factor to inflammation, which is also a large contributing factor to rosacea. It can also, the 1064 wavelength that you're utilizing, and again, this is just for you would treat something like a vascular concern in the same way that you would treat skin rejuvenation concern. Same settings, we're just coming in with that skin rejuvenation settings, and we are decreasing inflammation by doing that. We're also targeting, along with rosacea, there is a lot of clinical reason to believe that there's some mites on the skin that need to be destroyed. We know that 1064 wavelength can see some of the pigment within those mites and can destroy them as well. So there's some reasons that we know that we can treat or we can improve symptoms of rosacea by utilizing the Pico laser. There is some potential of reducing some fine diffuse vascular lesions, and that's going to be the very diffuse, but I still find that there is reason to believe that we're still utilizing, there's a place for that long pulse YAG and that IPL still on those vascular lesions. So with Pico laser, more so we're looking at the mechanism of decreasing that inflammation, decreasing the mites, just working on some of those conditions that surround rosacea. With acne, same kind of concept. We're coming in and we're decreasing the inflammation. We are potentially decreasing those sebaceous glands, the size and the output that can help with that acne. We're decreasing the mast cell count, which again is contributing to a lot of that inflammation associated with that. So lots of stuff that's happening in the background. This is a very brief insight into that, but at the Dallas show, I will be speaking directly to treating acne and treating vascular concerns and how to utilize our devices to do so, kind of in a deeper, more systemic way.
Well, perfect. Thank you, Maddie. So there are several more questions here where we've run to the end of our time. Let everyone know that we will look to answer these questions and send out our responses to ones that we've already addressed, as well as the additional one that we were not able to get to. So for now, Chad, I'll hand this back over to you and we'll wrap it up.
Perfect. Thank you so much, Peter. I do want to address one question that came into the chat regarding the Advantage Partnership Program, the APP. The question was about availability and how long that program is going to be offered for. We do have limited amounts of them, so it's a kind of a special program that we're doing for a limited time for a partnership program. So if you're interested in it, right, even if you're not sure if you're going to move forward with it, I highly, highly recommend filling out the contact form and at least having a conversation with your local Rohrer representative to see if you can move forward with it. Just due to its limited availability, it's the first time we've ever offered this. We are truly covering up to 12 months of payments. So it's not deferred, it's actually covering those payments. And the devices that we're talking about here tonight are eligible for that program. So with that, I do want to thank you for joining. If you have any other questions or would like to get in contact with your local Rohrer representative, please visit www.rohrersthetics.com and fill out the Contact Us form, and we'll be sure to connect you with someone as soon as possible. Thank you again for joining and have a wonderful evening.
Bye.